Hello, this is Dr. Donald Pelto, and I'd like to thank you for watching this DVD series that's going to go over the 9 steps to heal your foot wound fast. For those of you that are watching, you probably have a foot wound that's been open, or you're helping someone else deal with a foot wound that's been open for a while. You're not sure what to do, you're not sure what type of dressings to use, what type of treatment you should be having, but all you know is that your foot wound isn't healing fast enough. You may be in the United States, you may be in another country, you may be my patient or you may not be my patient. As we begin, I want to tell you that when you have a diabetic foot wound, when you have a wound in the bottom or in the middle of your toes or on your foot, it really hinders your lifestyle. You can't do the things that you want. Many times you can't work, you can't walk around, and you always live in fear. Fear of having an infection, fear of having an amputation, and it's a very big struggle. What I want to do today is to give you hope, because you have a problem. The problem is your foot wound. And the reason that this hasn't been solved is maybe because you're not seeing the right doctor, maybe you're not doing the right treatment, or maybe you have an underlying problem that you're not aware of that needs to be addressed, such as poor blood flow or such as a bony prominence. And what I hope to do with this 9-step system and in these different videos is to explain how to properly treat your diabetic foot wound. I've put together these 9 steps to help you heal your foot wound fast. I'm not saying that it's going to heal fast, but hopefully it's going to heal faster than it has been now. Before I begin, though, I want to tell you a little bit about why I put this together. See, I'm a podiatrist. I work in the United States, and I have many patients that I see daily that deal with foot wounds. And many times these wounds take a long time to heal. Many take months or even years to heal. Some of them get infected, and some of them even lead to amputation. And as I looked on the internet, as I looked on different resource pages, I found out that there's not very much good information about how to heal foot wounds. There's a lot of good information about taking care of your blood sugar, about taking care of your nutrition, but when it comes to having an ulcer on your foot, there's not much there. There's a lot of scary websites. There's a lot of scary pictures. If you Google the word diabetic foot wound, you'll get many scary pictures. And I found that a lot of people are confused. They're not sure what to do. They're not sure how to have their treatment directed. They're not sure who they should ask and who should even be on the healthcare team. What I'm going to do in this first section, I'm just going to review the 9 steps. The first step that we're going to look at is specifically your blood sugar and your nutrition and how this affects wound healing. A lot of you may want to jump into the later sections, such as how to offload the wound or how to debride the wound. That's important, but if your blood sugar isn't under control, if you're not eating the proper foods, that's another reason that you may have your wound delayed. The second step is looking at the blood flow and if there's any swelling. How do you determine how your blood flow is? Can you feel your pulses? Do you wear compression stockings? We're going to look at questions like that. The third step is looking at the skin and even the wound itself. Can you see the bottom of the foot to look at the wound? When did you first notice the wound? How long has it been opened? And then specifically, what does your wound look like? Does it look red and beefy? Does it look black? Does it drain? Can you see the tendon, or does it go down to the bone? All these are areas of concern. And I know that some patients and some people even watching this may think, well, I already have a doctor. I already have a podiatrist. But what I'm giving you here is helpful information to make sure you're getting the proper treatment and making sure that you're making the best decisions and even making sure that you're doing what you're supposed to be doing. Because I find, as with my patients, I tell them what to do, and many times they don't do it. And it's a very big challenge, and it's a struggle. And that's why I want to help you, to give you some resources that can help you make the right decisions. The fourth step is to look at the bone and pressure evaluation. Are there any bony prominences that need to be offloaded? Are there different types of problems in your foot? For example, do you have an infection? Has it gone down to the bone? Should you get an X-ray and MRI? We're going to talk about that a little bit closer. Step 5, we're going to be looking at your nerve and your feeling. How is the feeling in your feet? Do you have painful neuropathy? Do you have non-painful neuropathy? Is your feeling great, or do you not feel anything at all? And how do you determine that? The 6th step, we're going to be looking at how you debride the wound, or how you take away the tissue around the edge of the wound. Who should be doing that, how you can do that, and what's the proper technique for doing that on your wound. Why do you even need to debride it? Why do you need to take that hard tissue off? Why can't it just heal and callus over? We're going to look at questions like that. Then step 7, we're going to look at the different types of wound dressings and grafts that we use. What's the best type of dressing that you should use? Should you use a foam? Should you use an alginate? Should you have a synthetic skin graft, like a fake tissue put on there? How do you know which one to use? We're going to explain and show different types of wounds for this. And then step 8, which I personally think is the most important. How do we offload the wound? How do we offload it both surgically and with special types of shoes? Very, very important. And then step 9 is going to look at how you can prevent any recurrence and any other types of complications that are common with people with diabetes. So those are the 9 steps that we're going to look at. And we're going to look at those in the order. Now, if you want to switch to a certain section, feel free to watch that DVD section first or listen to that audio first. There's also a quick start guide with this, and also a wound tracking guide with this program. I hope you find it beneficial. And also, for more information, you can go to the website healmyfootwoundfast.com/members. And in that member section, you can log on and find much helpful information for you, additional information, because I'm always placing new content on there that's going to go into even greater depth on these 9 steps and answer many of the questions that my patients have. Once again, if you do have any questions you'd like me to answer, please email them to me at the email on this product that you're listening to. Once again, to your health. My name is Dr. Donald Pelto.